This is a failure to thrive tutorial presented by the SchrDbb. We reference a practical guide to issue taking and clinical examination by Anwar Qais Saadoon. Failure to thrive. Failure to thrive is a symptom of an underlying cause, not a diagnosis on its own. It is usually seen in a child younger than 5 years old and whose physical growth is significantly less than his or her peers. So we have non-organic failure to thrive and you have organic failure to thrive. Non-organic failure to thrive is poor growth without medical cause. If you have poor growth without medical cause, usually linked to poverty, poor interaction between a child and his own caregiver. That is non-organic failure to thrive. Now we have organic failure to thrive occur due to underlying medical conditions like inflammatory bowel disease or congenital heart disease. Now the issue taking in failure to thrive. So your issue taking, we have identification, we have the age, sex and all that, we have chief complaint, issue presents complaint, onset and duration of the failure to the symptom. When did the parents become concerned about the problem? And usually we have not defined failure to thrive yet completely, so you need to know that when you want to define failure to thrive, it should be less than when the child weight is less than 15 percentile on the Z-score of the weight to age ratio. It is the weight to age. So for you to say that it is failure to thrive, you need to know that on the Z-score we have 3 elements. We have weight to age, which is showing undernutrition. We have weight to height, which shows you have weight to age, you have height to age, which shows stunting, and you have weight to height, and weight to height shows wasting. Are you getting? So now when you have stunting, you need to know that there is a problem with chronic undernutrition. Are you getting? It's a chronic disorder when you have a height to age stunting. When you have undernutrition, that is weight to age is going to be an acute disorder. But when you have a wasting, that is weight to height, it's an acute on chronic malnutrition. Is it clear? So that's the element of the Z-score. So for you to say failure to thrive is when you have any of this. So any of this, mostly the height to age or the weight to age. When it is less than 15 percentile, you just call it failure to thrive. And the failure to thrive can be of organic or inorganic cause. So that's when you now come on your history of presenting complaint. You have it. You have the past history. You speak about that. The history of abortion, either spontaneous or therapeutic. Was the infant wanted? The number. So the infant wanted and other is for the case of a non-organic failure to thrive. Antenatal care, maternal infections. So you get maternal infection, maternal diet now is for organic failure to thrive. Maternal illness, hypertension, preeclampsia is organic failure to thrive. So we have past medical issue, previous hospitalization, previous infection. Now the social history and the feeding issue is very important. For an infant, the type of feeding, that's breast or formula feeding. If breastfed, then ask about the number of feeding per day, the duration of each feeding, satisfaction of the mother and the child. The second one is formula fed child. Then you have to speak about is what whole commercial food is the child eating, which milk is that, the detail on the frequency, the detail on the time the child eats, the detail on all that. So how many diapers the child have, is the child willing to continue to feed with this, is the child satisfied with the food he eats. That's it. Then the next one, older children, you have to speak about this introduction of semi-solid food. All your feeding issue has to be here because it is the most common cause of failure to thrive is undernutrition. So you have now, that's it. So the next one now we have family issue. So family issue is of consanguinity. You have to speak about consanguinity, parents, parental issue. Social, you have to speak about the interaction with other patients. That's for a non-organic failure to thrive. Review of system. So what are the key points on failure to thrive? Knowing the growth domain that that is affected first may provide clue for etiology. For example, child's weight is affected first. You need to know that if child's weight is affected first, the next most severely in acquired conditions, so followed by the learned. The first is the child weight is affected, the second is the learned that is affected, the last is the head circumference that's affected. That's a growth pattern for which is affected. The first thing that is affected is the child's weight, the second thing that is affected is the height, the length of the child, and then the last thing that is affected is the head circumference which is affected. And then there's also head circumference for age of a child. In congenital endocrinal and genetic condition, all growth domain may be affected symmetrically. So when all this is affected symmetrically, just know that it is congenital endocrinal or genetic condition. You can have a congenital endocrinal or genetic condition when all this growth domain is affected symmetrically. Congenital endocrinal or genetic condition when all the weight, the length, and the head circumference is affected in symmetrical proportion. Maternal hypertension precancer may result to small for gestational age baby. So although the infant of diabetic mother may have macrosomia, he or she may fail to gain weight due to postnatal cardiac complication. So the next thing you're going to visualize is headache. Thanks for your kind attention.